everybody, welcome. My name is Dr. Monique Nugent. I am a hospitalist based outside of the Boston area, and I'm joined today by Dr. Barry Greenberg and Dr. Eric, aka Docs Griggs. Let's start by introducing these two gentlemen. Dr. Greenberg is an associate professor of neurology and director of the Nascent Alzheimer's Disease Translational Center at the Johns Hopkins School of Medicine. Dr. Greenberg has been involved in Alzheimer's research and drug discovery since 1985, holding a series of positions internationally in the US, Sweden, and Canada, including within the biotechnology and pharma industries, as well as in academia. He's also the editor-in-chief of one of the leading scholarly journals on Alzheimer's dementia, and he brings a multifaceted perspective to Alzheimer's disease and an international reputation drawn from hands-on experience ranging from basic research and human studies. Dr. Greenberg, thank you so much for being with us. And Doc Griggs, it's good to see you too. Dr. Griggs is a community medicine doctor, health educator, and global advocate dedicated to making health and health literacy accessible and actionable for all. As Chief Health Officer of the Global Institute of Integrated Health, Associate Vice President of Community Health Affairs at Access Health Louisiana, and International Health and Wellness for the U.S. Congress, Louisiana 2nd District, he champions preventative care through education, screenings, and community engagement. With over a decade of impact at the Essence Festival and the Bayou Classic, his reach extends across television, radio, and digital platforms. With over 4.5 million engagements, his groundbreaking public health message has earned him an induction into the Library of Congress's Archive of American Public Broadcasting. Through social media-driven campaigns, his mantra, get checked, get fit, and get moving, continues to mobilize communities worldwide toward better health. Today, we are here to talk about Alzheimer's disease. And the community around Alzheimer's disease will touch a little bit about the state of affairs of medicine, health equity, and I know this is going to be a great conversation. But to start, I think we should probably start with some definitions, right? There's a ton of different types of dementia, everything from vascular dementia to Lewy body dementia. Dr. Greenberg, can you define for us Alzheimer's dementia?
Oh, that's a big question because we really don't have a singular answer to that.
Hmm.
Alzheimer's disease is a pathological diagnosis. It's a clinical diagnosis. It is characterized by a loss of memory and cognition, as well as a loss of function, activities of daily living. It's progressive, uh, but it also overlaps with other contributory causes of dementia. Only about 60% of dementia is fully Alzheimer's disease and not due to mixed pathologies.
Hmm.
So it's referred to as Alzheimer's disease, but it's also referred to as Alzheimer's diseases, if that answers your question.
Yeah. So a lot of times what I'll hear is like a port menu. People will call it old timers disease. I've heard that a lot, Doc. I don't know if that's something you hear people say in the community. And I don't think that's a misnomer fully. I think that it helps people to understand that it is something that is progressive, as we know that comes on sometimes during age. And I have found that is a way people have like expressed it in the community. But
There's a problem with that title, though, because not all Alzheimer's disease is old age.
that's very true.
Age is the number one, if you will, risk factor. Uh, but there's also early onset Alzheimer's disease. There are people who come down with Alzheimer's disease in their 40s, 50s, and 60s.
Hmm.
And it's not always the genetic form. So, by calling it old timers disease and referring to it just as a disease of aging, probably eliminates about 10 to 20% of people.
Yeah, that's very true. Dr. Griggs, do you feel how do you see it in the community? How is your community experiencing Alzheimer's disease?
So the interesting thing about that, I live in the lane of health literacy. We all, the
Mhm.
three of us, know that in medicine, literacy rates vary from state to state, and that health literacy
Mm,
is significantly lower, regardless of actually educational level. A lot of things are generationally transmitted to the next generation. Alzheimer's disease is something that you find in communities. Why? Because it's easier to remember than Alzheimer's, and it's
mhm,
easier to relate to. And when you talk to people about things, it's simply like hypertension. There's a lot of word identification, and people understand Alzheimer's. But here's the thing: generationally, it's we're evolving to a place where it's more comfortable to talk about diseases, particularly ones that our families might not understand. Alzheimer's and dementia, the old timers disease, is something that has for years been thought to be a process of natural aging.
mm.
And Alzheimer's is the only type of it's the prevalent type of dementia that most people recognize, at least recognize the word, and they don't recognize the contributions of other chronic diseases, as Dr. Greenberg knows in and out. And I'm sure is an expert. They called it Alzheimer's diseases for exactly that, but that's not commonly known. Does that make sense? So
It yeah, no, it does make a lot of sense, and what you talk about with, those other disease processes, right? So, like, I live in the space of acute care medicine, and when people come into the hospital, their children will often say, "I think my mom has dementia. I think my dad has dementia. It has to be Alzheimer's." But there's a slew of other things. There are a ton of other diagnoses that can be contributing to their memory loss, and at the time that I'm seeing them when they're, like, really sick, that's not the time to be making these types of diagnoses. And so there's this kind of disconnect, to the fact that dementias are not all Alzheimer's, right? And Alzheimer's is not all old timers, right? And what is the interplay of other disease processes, other risk factors, other environmental processes in um, dementia, aging, and memory.